Good morning, everyone. My name's Lindsay, and I work for Skills Development Scotland in the My World of Work Live team. My World of Work Live is about helping young people like you understand what jobs Scotland is going to need in the future and to help you understand the skills that you'll need for them. Today, we're going to cover a quick overview of the social services and healthcare sector. I'll introduce you to our experts today, and finally, we'll allow you to ask our experts questions. So please start submitting these via the Q&A box on the screen or ask your teacher to do this. I'd encourage you to get involved as much as possible, so ask us questions as we go through, and we'll try and answer as many as we can. I'd just like to let you know that today's session is being recorded, so young people who couldn't make it today can still access these resources. It'll be available for everyone to watch on the My World of Work YouTube channel. This means that you can go back and rewatch everything that we've talked about today, so don't worry, and everything you ask will be anonymous, and you can select that option on the Q&A box. So before I introduce you to today's experts, let's have a look at the social services and healthcare sector. So there's nearly 11,000 registered social workers in Scotland. It's a 3.3 increase since 2011. 55% of these work in councils. They can also work in hospitals, schools or charities, for example. The average social worker salary is £35,000 per year. Senior social workers and managers may earn more than this. You are required to gain a degree from university to work in social work. So this could be an undergraduate or a postgraduate, but you could do a foundation apprenticeship in school right now to get you the experience and provide you with a good starting point. There's also modern apprenticeships in social services and healthcare that would give you a good head start into this sector as well. And there's no specific entry requirements to begin this apprenticeship. Employers would just be looking for people who are enthusiastic and keen and interested in the sector. There's lots of different roles you can do within social work depending on your interests. For example, you could work in criminal justice role, mental health support, or working with vulnerable families, children and adults. And there's lots of opportunities for development and progression within social work. So now I'm going to introduce you to our experts. So let me introduce you to Toyin, who works for Fife Council, who's a frontline practitioner. So I'll let Toyin go over her slides and introduce herself. Good morning, Toyin.
Good morning. Thanks for that. So my name is Toyin. I'm a frontline practitioner. At the present time, I am working with Fife Council as an agency social worker. I come with a managerial background in social care, which means I would have worked in social care for a number of years as a manager, managing some services in adult care before I came into social work. I would have worked in Ireland, Republic of Ireland, Northern Ireland, before I moved to Scotland in 2015. I am very keen to improve the experiences of social workers that are from a minority ethnic background. And I try to advocate for them and to promote their interest in all my interactions with services. I also work in collaboration with various partners such as SASWA, that's the Scottish Association of Social Workers. And at the present time, I am studying for a PhD, and I've just started my third year. And as an expert in social work, I wouldn't say I'm an expert, but as someone that has worked in social work for a number of years, it's a very interesting profession. It's a very fulfilling profession, and it's a profession you will enjoy if you think it's a pathway you want to explore. Thank you.
Okay, thanks, Toyin. Now I'm going to introduce you to our second expert, who's Jo, and Jo works for NHS Highland as a senior social worker in adult social care. Again, I'll let Jo go over her slide and introduce herself. So hello, Jo.
Good morning. Yes, my name's Jo. I work in Fort William for NHS Highland. Social work adult social work has been fully integrated with health in the Highland area. So I'm working as a senior social worker. That means I have some cases, but I also support and manage people in the team, other social workers and non-qualified social work assistants. I used to work in Stirling, managing an adult social care team there for 6 years, and then wanted to move back to the Highlands. I used to work in the field of dementia and adult mental health, which was very rewarding. That's when I was in frontline practice. My key areas of interest are adult support and protection, which is a piece of legislation that came in to ensure that vulnerable adults are supported and protected, just like we have legislation to support and protect children. Social work supervision is where we offer a senior social worker or manager will support the team to manage their caseload, but also deal with the emotional aspects of the work, which can be quite challenging sometimes. I studied social work in Aberdeen. It was a degree in adults, a degree in applied social studies with a diploma in social work alongside it, and I was a mature student. Before coming into social work, I've done lots of different things. So you don't have to make a decision from school to go into social work. It really is valuable to have life experience. And a lot of my work was around working with people. And so when I decided to go into social work, I thought I need a career where I can earn enough money. I want to have a family, but I also want to do a job where I can help people and support equality in society.
That's great. Thanks, Jo. So I'm now going to kick off with a couple of questions. So we'd really like our audience to send in questions via the Q&A box, so please pop them in when you can and we'll ask our experts. So I'll start with Jo, since you're on screen. Jo, what subjects would you recommend that I could do at school to help with social work?
So you need to be a good communicator. So anything to do with communication, your English, sociology, psychology, if that's available, and the basics of maths and English. It's helpful to have. You don't have to be good at math, but it helps to have some kind of grounding, because sometimes you will be looking at budgets and costing and things like that, depending on which route in social work you go. But yeah, anything to do with communication, studying politics if you can, so modern studies, all of those social subjects are useful.
Great, thank you. I'll pass over to Jo. Sorry, Toyin. Have you anything you want to add on to that? Any more subjects you would recommend young people doing at school?
No, I think Jo has covered most of them quite well. So yeah, she's covered it.
Great. So I'll stay with Toyin. How did you get into this career?
Like I said, I was working in social care previously, managing services, before I decided that, okay, I've reached the peak of my career and I wanted to do something more and to make more of an impact. And that's when I decided to go into social work. Like Jo said, I was a mature student as well, but I started with a master's in social work, and it was after that I started the profession. My thinking around going into social work, like I said, I'd reached the peak of my career in social care. I wasn't making that much of an impact, or I didn't have the legislation behind me to make an impact. And I thought, okay, I need something that would, I will have the backing of legislation behind me when I am making contact or when I'm engaging with people. And that sort of influenced and informed my decision to go into social work.
Great, thanks, Toyin. So same question to Jo. How did you get into this career?
Yeah, I think I briefly touched on it in my introduction. I had done lots of work where I was working with people, so retail, catering, done childcare. I was a nanny for a while, and then done work in outdoor holidays for children, and the groups that rewarded me most in that work were young people who had come from perhaps disadvantaged backgrounds, or had come from a care background, and I really found it rewarding working with them and introducing them into different environments and connecting with them. So for me, I then started thinking, well, what work could I do that would allow me to continue to work with either vulnerable people or disadvantaged people. And it was a conversation with an ex-school friend who'd gone on to do social work that said, oh, why don't you study social work? So I did a bit of research. I did an access to degree studies, because it was quite a while since I'd been at school, and then I was able to apply for university.
Great, thank you. So I'll stay with Jo for now. Have you always wanted to go into this kind of work? I think from what you're saying you have. Like, has anyone ever inspired you, or anything inspired you to do that?
I think the pathway in was wanting to work with people. In terms of inspiration, once I started my studies, there was a lecturer who was very inspirational. He'd worked in social work for many years, and he had lots of interesting stories about that and advice on how to look after yourself as a social worker, because it can be quite demanding on yourself. You bring yourself to work a lot, and in a different way, I think, than other careers. So they were an inspiration. And one of my supervisors, early on in my career, she was very influential, very good at getting me to solve the problems myself rather than telling me what to do. And I think that's really rewarding, because you learn self-reliance. You start to trust and believe that you do have answers, and you can help other people find their own answers.
Great, thank you. So same question over to Toyin. So have you always wanted to work in social care, and has anyone ever inspired you?
No, I wouldn't say I've always wanted to work in social care. I started in social care as a matter of what was the most reliable or easy access job I could get, and that's how I got into social care. I do have a degree in sociology, which is way many years ago, but at that point when I did that degree, it wasn't to use it to work, it was more something to do at uni and have the qualification. Going into social work, I will say my greatest influencer would be my late grandmother, my maternal grandmother. I reflect on the things she did when I was young back in Nigeria, and I can say that has influenced me going into social work. She was so caring, she was so supportive, she had an open hand for everybody that could come into the house. And I think from that, I've come into social work with that sort of belief and that sort of help people, support people, not help, support people, empower people, and be there to contain the crisis and get people to think outside of the box to say, okay, what can I do to help it? I believe so much in somebody taking personal responsibility, and that I try and use in my practice. So social work, coming into social work, my grandmother, my maternal grandmother, was a very great influencer in going into the profession.
Yeah, she sounds like a lovely person.
So
I'll stay with Toyin for the next question. So I've got someone asking, has COVID affected your job, and do you think it'll affect the number of jobs in the sector in the future?
Yes, I would say COVID has impacted our job, and it will continue to impact it. It has impacted in several ways. It has made it better in some ways. it has made it worse or more challenging in some ways. It has made it better in that during COVID, especially during the lockdown, we had more flexibility to work with people, to work directly with people. It has made it a bit more challenging in that the difficulties we're facing as a frontline practitioner is becoming quite more challenging because we don't have the services, we don't have the resources to signpost people or to point people to go to. For instance, some day services are still closed or they have limited availability for people to come into them. So things like this are making it quite more challenging, and COVID is impacting on that. With regards to having more people, having more social workers in the practice following COVID, yes, I think it will always get bigger. We will always need social workers, irrespective of COVID or any pandemic or anything that's happening. Social work would always be relevant. I don't think the society can do without social work, so it will always be relevant irrespective of COVID.
Yeah, definitely. I would agree with that. That's a great answer. So the same question over to Jo. Has COVID affected your role, and how do you think it'll affect the sector in the future?
So I wasn't working in social work for the main part of the pandemic. So the first lockdown, I was doing other things. But coming back into social work at this tail end has been really interesting and challenging. I think the positive things that have come out of it, as Toyin said, people are working more creatively. We have made advances with technology that would have taken years to do in the past, and IT teams have come together and helped develop technological solutions to things, particularly meetings in NHS Highland. We cover right from Fort William right up to Wick and Thurso. It's a huge area. So when we have meetings, we're not having to travel in the same way as we used to before the pandemic. So that's a positive. One of the there's something that's kind of partly positive and partly negative in that I think wider society has realised just how much they rely on social care workers and health workers, and when we are under pressure and depleted, they are seeing the consequences of that. So I think it's really focused attention on what society needs to do to improve healthcare, social care and social work. And hopefully there'll be changes that come out of that. There have been various reports looking at what happened during the pandemic, and I think there are plans to make improvements on the back of that. So I think that's a positive. One of the challenges is that we have fewer people available because people are either getting COVID or been in contact with someone with COVID. So services have fewer staff. So going out and delivering care, it's much harder to get care packages, so people going to visit people to help them and support them. And also if we're trying to admit people to a care home, we're often getting care homes that are closed because there's been an outbreak or there aren't sufficient staff to take in more people. So it's been it's been a challenging time, but an interesting one.
Yeah, definitely. I think that's the same for a lot of people as well. It's COVID. So I'll stay with Jo for the next question. So someone's asking, what skills are important to do your job?
I think being able to communicate with all types of people and make a connection, so that you've got to be able to build a relationship in order to work with someone and help them achieve their outcomes and goals. Another skill would be, well, I don't know if it's a skill, a personal quality of resilience and being able to reflect on how you're managing with your work, because it can be quite emotionally challenging and stressful. So having the ability to manage your stress and seek support from your line management, that should always be built into the job. You should have someone who you can turn to for support. Yeah, so it's being able to self-reflect and communicate with others would be key aspects, I think.
Yeah, definitely. Thank you. So I'll ask the same question to Toyin. So what skills do you think are most important to do your job?
Short of sounding like radio, what Joe has said is very relevant. You have to be able to communicate and work with people. You have to be able to manage your stress and to understand that, okay, this is work. These are the boundaries. Be organized enough to have a good work balance. I think that's very important. It's a very important skill that I think all social workers need to have, because there's a tendency for us to take over, and even regardless of the time we work our working hours, to still continue to reflect on it and think about it and see, how can I change it? How can I make a difference? So we need to have that capacity to be able to manage our diary and say, yeah, it's 5 p.m. I'm finishing. That's it. Work is finished. I need to move on. I believe in a skill of empowerment, having that skill to empower people, to work with people and let them take over and be at the center of their problem. They have the lived experience. They are the experts of their lived experience. So we need to have that skill to let them think about their situation and see how they can make it better, and we empower them to make the situation better rather than taking over. I think it's very important as a skill to have as well as a social worker.
Great, thanks, Toyin. So I'll stay with you for the next question. So someone's asking if they can do an apprenticeship in this kind of sector to get into this kind of role.
A paid apprenticeship, I am not sure if that is available. And I'm not saying it's not, I'm just not aware of it, I'm not sure. But you can go into it as an apprenticeship or volunteering, working with a social care organization, or as a social work assistant. If you can get into the job, that can be another route to go into social work. But as paid apprenticeship, I'm not aware of it.
Okay, so is there any kind of work experience that a young person could get right now, like voluntary work or anything that they could do at school?
Yes, I think the voluntary sector is a very good area to start off, to understand what it's like to work with people, especially people with additional needs. So it's an area where young people can start while they're in school. If they can get that position, it's very open. I know now with the shortages in workers, I know most charities are quite open to getting people to come in to volunteer. I was in a meeting during the week, I think that was on Tuesday, and we're looking at the challenges we're facing as a sector, especially around care at home. And there's going to be a drive by the government, it's supported by the Scottish government, where employers will go into schools, go into universities and advocate for people to come into the sector, to come into social care and see what it's like to work in it if they can, or to even volunteer in it. So it's an area where I think students and young people can start off with, to have that understanding, because it's good to have an understanding of the sector you're going into if you're thinking at all about going into social work.
Yeah, I think that's great advice for any young people watching that might be interested. So I'll go over to Joe for the next question. So Joe, someone's asking if there's any opportunities for progression and development within social work.
Yeah, a good social work job or department should offer ongoing training and career development, professional development as part of your work. I think most social workers like to think of themselves as people who want to continually learn and improve, and you should never feel that that's it, you can do it and not want to develop or learn new things. So there's additional training you can have in your role. If you want to move into sort of the management side of things, there are opportunities for that. Personally, I did what they call an acting up role. I had a lot of experience, and one of my colleagues was going off to have a planned health thing, and I was asked if I wanted to do their job for a few months while they were off, and it gave me the opportunity to try the role and see if I could do it, but also then could go back into my original frontline role if I wanted to. And so you can have acting up opportunities. Sometimes you can just take the initiative and offer to lead a peer group, perhaps. If you're working as carers, say you start off in the care sector and you're giving care to people, you could start a group with your colleagues to talk about what you do and how you do it, and peer support, and then you can use that as an example if you're applying for a more senior role. You can say, well, this is something I've done that shows my leadership potential. But there's lots of routes. I think the one thing to remember often in social work is as you move up in management roles, you get further from the people you perhaps originally came in to support. That was one of the things for me that I went to management and then went back to it as senior practitioner, so I could continue to have casework as well.
Yeah, definitely. So I'll stay with you for the next question, Jo. What are the most enjoyable parts of your job?
I think being allowed into people's lives. In adult social care, there's not really any legislation that compels people to work with us. People don't have to work with us like they do in, say, child protection or criminal justice. People choose to work with us, and that being able to build a relationship, and they let you into their life and let you support them and work with them, and I think that's a huge privilege. I think being able to connect with others is one of the best parts, and seeing people progress and make positive changes, even if they're very tiny ones.
Yeah, definitely. So I'll go over to Toyin, just to the same question. So what are the most enjoyable parts of your job?
Having the privilege to work with people and to engage with people on a daily basis. That's one of the areas I really appreciate in my job, because I wouldn't have had that opportunity if I wasn't a social worker. Listening to people talk about their experiences, the good and bad experiences. Sometimes it's not just the bad they reflect on, just listening to that and hearing the very rich detail about their lives. You know, I'm frankly a stranger that comes to the door, and because of the badge I hold and say I am a social worker, I'm allowed into the door. I'm treated quite nicely, and I'm told personal stuff. I hold that as a privilege for the position, and that, like I said, is one thing that I really appreciate about my job. I look forward to it. I look forward to the day when I have visits all day, when I'm out and about and visiting people and talking with them and just having a conversation around their difficulties or around the life they've lived. I just enjoy that. I enjoy that in my job. I don't like the processes. I absolutely don't like the processes we have to go through or the loops we have to jump through to get funding or for services, but I absolutely love just engaging with people.
Definitely, thank you. So following on to that, from that question, you've kind of answered it a wee bit there. What are the biggest challenges in your job?
Yeah, the processes we have to go through, that it's just so, it can just be so frustrating on a day when you have to sit in front of a computer and go through forms and go through questions to get a service in place. You have to justify your thinking. And I don't have a problem with justifying my thinking, but justifying my thinking like 3, 4 times to different people, that becomes really challenging and quite frustrating. And at the moment, the lack of resources we have to get people into, to get them out of the house, especially where there's social isolation there, the lack of resources we have, that again is very frustrating at the moment. The fact that the budget we are working with is shrinking on a daily basis is also quite frustrating for me as a frontline practitioner, and I know some of my colleagues face that difficulty as well. And in Scotland now, social care and health is supposed to be a partnership. It's supposed to be integrated. But when you are working with people that don't have that take of social, I'm looking at it from a social ideology, I'm looking at it from a perspective that's different from yours. And when you're having to explain and to work with them, make them understand, that can be quite challenging as well for me as a frontline practitioner.
Great, thanks, Toyin. So I'll ask the same question to Jo. So what biggest challenges do you find within your work, and how do you manage those challenges?
Yeah, as Toyin said, the bureaucracy, the admin, paperwork. There are forms, assessments, all the recording. As in, you've got to make notes of everything that you do, the decisions you make, and that's to back up so that people can oversee your work and make sure you are actually doing what you say you're doing. So that's a big challenge. Again, the lack of funding. Although I do think that's one of the positives of COVID. Society has realised that health and social care is underfunded, and if we want to be well looked after, if we want our loved ones to be well looked after, then the country is going to have to invest in that. So I think that hopefully that's going to be a positive outcome. So yes, constantly trying to find funds in order to support people. The lack of bodies on the ground to provide the care that we're assessing. We're assessing that somebody needs support, and then where do we find that person who's going to actually give that direct support? So how do I manage it? I think a lot of it is supporting people through the process. So our service users and their families can get very frustrated with how long things can take. So it's about keeping in touch with them and supporting them, sharing their frustration and saying, yes, we're frustrated by this too. And we're supporting them to manage that. Personally, my own stresses from the work. I think Toyin mentioned earlier, making sure you look after yourself, stopping work when you're supposed to stop work. And that can be hard when you know that there's somebody in need, but And this is one of the wise words that my lecturer said: you can't take a shirt from a naked man. So if you've given everything, how can you then give more? So you have to look after yourself, do your self-care, do nice things, be kind to yourself, and then if you are full and well looked after, you can then support other people.
Definitely.
And I like to do enjoyable things that I enjoy.
Yeah, that's a great piece of advice. So I think that'll have to be our last question, unfortunately, because we're mindful of time. So I'd just like to thank both our experts for giving us such an insight into what they do. And I'd also like to thank all of our young people for joining us today. I hope you found the session useful and you've learned more about the social services and healthcare sector. So to finish off the session, I just want to highlight our careers website for young people. That is myworldofwork.co.uk. You can find out more about careers on our website, and you'll find out lots of information there that can help you make choices about your career. And if you need any further inspiration on what to do, there are tools on there that will help you understand your strengths, and there's lots of job profiles that you can explore as well. If you're interested in finding out more about working in this sector, then there are other websites available, such as careersincare.scot, that are available for you to explore what opportunities are out there as well, specifically in social services and healthcare sector. And finally, if you're interested in finding out about apprenticeships, then please head over to our Apprenticeship.scot website and you can find out all the information available to you there. Thank you for joining us today and have a great day.